In the COVID ICU, I had the privilege of caring for a young woman in her third trimester of pregnancy. She was admitted with severe COVID pneumonia and ARDS that required high amounts of sedation and paralysis so that we could manage her breathing while she had the breathing tube on the ventilator. And given how sick she was, in addition to our usual therapies, we spent additional time coming up with plans and backup plans for how to best treat her and her baby. And despite all of this, we worried. We continued to worry as she was emergently whisked to the operating room for a C-section and breathed a sigh of relief when we heard that she and her baby had done well. We continued to worry as we treated her pneumonia, and thankfully she made enough progress where we were able to remove the breathing tube. Afterwards, we noted that she remained quite confused and delirious, which is a common side effect of many of our critically ill patients, and unfortunately can have long-term implications for weeks and months to come after their hospitalization. Regardless, she was well enough to be able to leave the unit, and so we sent her to the floor. And about a week later, I heard from one of my co-fellows who was on service, and he had emailed all of us who had taken care of her saying, "I got paged, she's being discharged today and wants to meet her ICU team." And we were all so excited to hear this news. After all that she had gone through, we were just encouraged and grateful that she wanted to share this moment with us and celebrate together. You know, many times in the ICU, we often don't get to see what happens to our patients after they leave. We don't see them on the floor, we don't see them in clinic after they've been home and recovering. And I think at this point in the pandemic, regardless of whether or not you work in the hospital, many of us are feeling at times discouraged and tired. And this patient and her email just remind me that this is why we do what we do. This is why we keep on keeping on, and this is what gives me hope. So to my patient and her baby, thank you for that reminder. We're rooting for you, and stay safe.